Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
They're polite. They just take the time for you.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
I like the Angels for what they've done for me.
Angels Care Home Health. We serve patients.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching, and thanks as always to the producer of our series, Jeff Durall. We're in the offices of the Department of Psychology and Julie Zollinger, who is the USD 489 school psychologist, as we talk a little about her work as not only school psychologist in the district, but also in the special education co-op as well. First of all, though, we've got to go through all of the awards here, and I've got a lap full of them that Julie has won over the years. First is the Award of Excellence from Fort Hays State University, the Virtual College Adjunct of the Year Award. Julie has been adjunct professor at Fort Hays State University, now going on 7 years, and has received last year the College of Arts and Sciences Award, sponsored by the Virtual College. And then this year she has received from the Kansas Association of School Psychologists for 2015 the School Psychologist of the Year Award. Julie Zollinger, congratulations on your awards.
Thank you.
Tell me about the Special Education Cooperative. What's that all about, Julie?
Our special ed co-op covers 4 school districts. It covers the Hayes School District, of course, and also the surrounding smaller school districts of Ellis, Victoria, and La Crosse. In addition, we cover, as a co-op, cover all the private schools that are in Hayes also.
How did the award come about?
That was quite a surprise. The other school psychologists that are in Hayes and cover in the co-op nominated me, and I did not know it, and we went to the Kansas City area for our annual conference, and they said my name. And there it is.
You are one of a group of psychologists who work through the district, right?
Right. There are 8 of us that cover the co-op.
And how does that work as far as the co-op goes? You go to individual schools. Give us the scenario here, how that works, Julie.
Right. Each of us are assigned schools. Mark Hotman is our director, and he tries his best to make it equitable as far as our caseload, which is the total number of students in each school. Some of us have mini schools, like 3 or 4. Some of us have a whole school district. Those that have the smaller school districts cover that entire school district. Those of us in Hayes are kind of split up a little bit. Like I have Hayes Middle School and cover Holy Family Elementary. So it's 2 different systems that have to work together for my job, which has worked well this year. So yeah, we're spread quite thin. But even though there are 8 of us, there are just a lot of job duties that we have that are beyond what the typical school psychologist does in a lot of school districts.
In the award for the Psychologist of the Year award that you received, Julie, what do you suppose the qualifications were that they considered in the voting process?
Well, I'm a very humble person, so I don't like to say things I've done.
I know that's the reason I wanted to force you to say, well,
right.
Why did I get this award?
Right, exactly. There are so many other school psychologists that go above and beyond and try to do what's very best for students and families and schools and the systems. Schools as a system. Over the years since I've been in Hayes, I've just been given the opportunity to push those skills I've been trained in my grad programs, and I had administrators that let me do that. I just took the information to them. This is what the research says works for kids and teachers, and they let me run with it. The school psychs apparently recognized that, and I I've just done some various other little things that have been helpful to our co-op. So it's they just saw that.
How does the adjunct professorship at Fort Hays State play into your role as school psychologist? What's the connection there?
Well, that's a good question. It's a great way for me to stay on top of the best practices for school psychologists. In addition, I'm training the new psychologists that are coming out that are going to replace me, and down the road. There's a shortage of school psychologists across the nation, and so we're at Fort Hays. We're really trying to recruit good quality candidates from around the U.S. and the world to become school psychologists. I also take on the supervision of several practicum students. Over the years I've done it. I have one this year, for instance. I do it about every other year. It's about all I can handle. It's a lot of work. But those students have been in my class in the previous year. So it's nice to get to know them as a student online, and then seeing them in person and seeing how they apply those skills that they've been taught to the real world of school psychology.
Part of the pluses of a virtual college at Fort Hays State.
Absolutely.
So what is the job? Tell us what you do and what it's all about.
Right. In general, what we do is work to meet the academic, social, emotional learning needs of all students. We do that through prevention activities, through consultation, through assessment, therapy, and interventions.
And this works with groups, one-on-one, both?
Both, right. It varies across all the school psychologists how much time we get to be able to do individual and group activities. Most of my time is spent with consultation with teachers. At the middle school, that's primarily what that is. I do a lot of assessment with students individually also. Sometimes if there is time, I do individual work with students, some therapy with them. Group work is something I've done in the past, kind of off and on. If there's a need for group therapy, then I do that. So we're trained to do that. There's just sometimes not enough time.
Time is a big factor, isn't it? With
It
the
is.
numbers of students, perhaps the increased problem areas that students may face, because you're covering all aspects of the human condition, aren't you?
Right, exactly. And we cover birth, just about birth as school psychologists, all the way through age 21 when students exit out of special ed services. So it's the whole gamut of students.
And then
we're
when you
trained to
reach
help
the
with.
middle school years, as Jeff and I were talking about earlier, then you just compound the problems that kids are facing.
Right. There's a lot of issues that just come together at middle school. It's a very unique area for sure. You have to love middle school age, pre-adolescence, early adolescence to work in middle school.
But once again, if you're working with individuals with so many areas of concern, whether it's academic or social or whatever the case may be, it can stretch you pretty thin.
Absolutely. A lot of different things. Any given day, students or teachers can come to me and express concern about academics with the student, and then the next teacher that comes in may be telling me about a family crisis that a student is having. And we just have to prioritize, which one is the most important right now, today, and deal with that.
What have you seen over the years of your service with 489? Has there been an increase in areas of concern?
Unfortunately, yes, we're seeing an increase in students that have emotional and behavioral needs, whether or not they're identified as students in special education or not. Students are just coming in not prepared to learn. They're missing many skills that students 20 years ago had. So that's a concern. So our job as a school system has had to adjust and evolve to meet those needs of those kindergartners coming in and students that move in that are older that don't have those skills.
Julie, we've heard that term, not prepared to learn, many times. There are a lot of factors that are involved in that. We've heard that even a good meal to begin the day, a breakfast, those types of things. There's so many things that impact the ability to learn, aren't there?
Right, absolutely. With the economy the way it is, we see so many students coming to school who have not had breakfast, who, if they did, it wasn't a very healthy breakfast. We have students coming in that the family cannot afford school supplies, and we have some older ladies in our community that have donated funds to me that we keep in an at-risk fund in our at Hayes Middle School, and we use that to buy school supplies, and I'm kind of the keeper of those supplies, and I've had probably every day on average this school year, or every week this school year, I've had at least one student come in and ask me about getting a trapper. That's the most expensive school supply, and those get used every day and they get worn out, and I explain to the students where that fund, that money comes from, and talk about paying it forward when they get older and they have a job and they have a little extra money, pass it along. And so I hear these stories from these kids that the parents have to pay the utility bill or have to buy food, so they can't go out and buy a $20, $25 trapper to carry their supplies in. So families are struggling for sure.
And when the families struggle, that impacts the students on a direct basis.
Absolutely, absolutely. Homework and studying for tests gets put on the back burner, and that is hard for school folks to understand. Sorry, it's hard for school folks to understand that these kids are struggling with these other personal issues and to eat and where they're going to sleep that night,
and all
so
of it
tough.
Impacts that ability to learn.
Right, absolutely.
The administrators, the teachers, the faculty really are your first line of information, aren't they?
Right. The students go to the counselors, go to the teachers, the principals to express their concerns. Their students, in middle school don't want to share too much about their family unless they're in crisis. If they're emotional about it and they can't be in the classroom, then they'll go and talk to someone. Sometimes they'll come see me. Most of the students don't know exactly who the school psychologist is. I kind of wander around the building, pulling kids out of class, talking to teachers. So they see me around, but as far as what I do, not really. But there are some that do and pop in and share what's going on with them.
In our final moment or two, Julie, what got you started? What were your influences, educators in your past, people that made influences on you?
It's kind of a winding road. I knew I wanted to go into the helping profession. My first major was nursing, but I got into the blood, and that was enough for me. So I quit that. Went over to psychology.
It's not the first time we've heard that,
right,
is it? Yeah.
So went over to psychology, and then I had never heard of school psychology. So ended up going into graduate school for that. But as far as people along the way that helped me, I had some ups and downs through my childhood, difficult times, and had some teachers that knew exactly what was going on with me and assisted me the best they could. And then there were other teachers that did not, and I didn't want students to feel that way, that the teachers were just busy doing what they needed to do and didn't care about the students. So anyway, I just kind of fell into school psychology, went to Utah State for graduate school, my master's degree, and it was a great program up there, and getting another award for that next month I didn't mention to you from the college up there.
So we're coming back then, basically.
Right. No, that's okay. So it's just a great honor, and then I earned my EDS down here at Fort Hays once I moved here. Decided to just finish that up. So.
And in our final moment, how can parents help support your work?
Just early intervention. As soon as you have a child, start reading to them, exposing them to just experiences, taking them to the museum, to the park, to just talking to them, explaining things to them, how things work, identifying what's in their environment, talking to them about how to problem solve. There's students that come in that don't know how to just do something, and so they just need that actual direct instruction to do that. So that starts early, and then as they go through school, just helping with the homework. If parents are having trouble doing that homework, which some math, we hear that a lot, then bring the child to school, before school, after school. Parents are always available, or teachers are always available to help students. They just have to come in and get help. So
Stay involved.
Stay involved, stay on top of things, contact the teachers contact parents.
Julie Zollinger, who is an adjunct professor at Fort Hays State University, the Department of Psychology, and also a school psychologist for USD 489, and the Kansas School Psychologist of the Year, our community connection.
Angels Care Home Health, serving Hays and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
And the Angel Care nurse comes to see me once a week.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
Angel Care has helped to stay home.
Angels Care Home Health. We serve patients.